Hello, my name is Travis and I'm a first year nursing student at Calhoun Community College. And today we'll be talking about the head to toe assessment. At some point in our life, we will all be under the care of a medical professional, whether it be in a hospital setting or in a doctor's office. And the purpose of this evaluation is to give us a baseline of your health and your well-being and give them something to work on. If anything changes in your health status, they'll know. And we'll be using some equipment to do this. One thing we'll be using is just a standard stethoscope. Most people have seen these to listen to your heart and lung sounds. We'll also be using just a regular pen light, nothing fancy about it. And I'll be using a small key, and we'll explain that later. And we'll be using this Q-tip, so just like any Q-tip you have around the house. And so the first thing I want to do is I'm going to assess my patient's level of consciousness and their cranial nerves. And the way I do that is I'll have my patient enter the room, say, patient, please enter the room, and have a seat. Now, the first thing I'm observing is I'm observing the person's gait as they walk into the room. I notice that they're steady, they're balanced, and their head is upright and even. There's no shaking and anything of that sort. So, first I'll have to assess her level of consciousness, and I'll say, hi, can you tell me your name?
Crystal.
And I'll say, do you know where you are?
I'm at home.
Yes. And I'll say, do you know what time of day it is?
Evening.
Yes. So now I've established that she is oriented to her person, her place, and her time of day. So next I'll be assessing her cranial nerves, and the cranial nerves affect the face and the optic nerves, and that's anything involved in the sensory part of your brain. So what I'll do is I'll say, Crystal, I'll say, can you look at my finger? And I'll say, now follow my finger, and I'm going to have you follow it in 6 different locations. Now keep your head still. Only follow with your eyes. So I'm checking her ocular motor response. And I notice that her eyes are able to follow my finger. Now, what I'll use the pen light for is I'll be checking her pupillary response. And what that means is I'm going to see how her pupils respond to light. So I'm watching her pupils, and I'm going to bring the light into her eyes, and I notice that her pupils react to the light. Now, that means her optic nerve is intact. So, the next thing I'll be checking is what's called stereognosis. And I'll have her close your eyes, and I'll have you hold out your hand. Now, I'm going to have a common object. It could be any sort of object that most people would recognize by touch. And I'm going to place it in your hand. I'm going to say, can you tell me what that is without opening your eyes?
The key.
Yes. Thank you. And this lets me know that she's able to pick out an object that most people would pick out by touch. So, the next thing I'm going to do is I'm going to check out her skin for lesions or scars or anything abnormal. So, I'm going to have you hold out your arms. You can open your eyes now. And I'm going to check her skin, and I'm going to note that her skin is warm to the touch. She's not cold. She doesn't have any cold spots around her arms or her legs. And I'm using the back of my hand. So, I'm also going to check and make sure that there are no lesions or scars or any open wounds on her body. And I'm going to also check what's called turgor, or elasticity of the skin. And the elasticity can be checked by most people. You can check it by using the back of the hand, and you raise the skin up and you watch as it goes back in. And this shows that her level of hydration is normal for her body. So now I'm going to check next thing I'm going to check is their cardiovascular system. And that's what I'm going to use the stethoscope for, excuse me. And I'll be using the stethoscope. I'm not going to put the stethoscope in my ears because I won't be able to hear you, you won't be able to hear me. And so what I'm going to check is I'm going to check her heart valves. I'm listening for not the beat of her heart, I'm listening for the opening and closing of valves. So I'm going to check those in 5 different locations on her chest. And I would check these here, and actually over here. And that's going to tell me that she has normal heart rhythm. It's going to tell me that her valves are opening and closing like they're supposed to. I'm also going to check her breathing. And the way I do that is I'm going to start on her back, and I'm going to check it in 10 locations. And I'm going to ask her to breathe in. Each time I move the stethoscope, she's going to take a breath. So I'm going to check it in 10 locations on her back, and then I'm going to check it on 8 locations on the front. Same process. And I'm going to move across the lungs in a zigzag pattern. Then I'm going to ask you to raise your arm, and I'm going to check her breath sounds on the side. And once I've done that, I've established that she has breathing her normal breath sounds and there's no adventitious or abnormal breath sounds in her body. And hopefully this will give you an idea of what you're going to expect if you're ever in a situation in being assessed by a healthcare provider. So you won't be nervous, and you'll be able to face this with a little bit of information. Thank you very much.